Hello, everyone, and welcome to today's Explainer. I am Dr. Evidentia, and my mission is to help you make informed health decisions using reliable, evidence-based science. Today, we're diving deep into a condition that silently affects literally hundreds of millions of people across the globe. We're talking about arterial hypertension, aptly known as the silent storm. It's basically a condition where your arterial blood vessels are under persistently raised pressure, which puts your entire cardiovascular system under immense stress. But you know what the most alarming part is? It usually happens entirely under the radar, without any obvious symptoms at all. So, that brings us to a really crucial question. Are you weathering this silent storm without even knowing it? Because high blood pressure is largely asymptomatic, a lot of people go about their daily lives completely unaware that their internal plumbing is under dangerous levels of strain. Honestly, it's usually only when this persistent high pressure causes severe end-organ damage, leading to devastating events like heart attacks, strokes, or kidney failure, that the storm finally makes itself known. And that right there is exactly why early detection and understanding the mechanisms behind it are absolutely vital. Now, before we jump right into the science, just a quick medical disclaimer. The information provided in this explainer is strictly for educational purposes, okay? It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider regarding any medical conditions. My goal here is simply to empower you with the evidence so you can have better, more informed conversations with your doctor. All right, here is our clinical blueprint for today's explainer. 1. The silent storm defined. 2. Causes and hidden triggers. 3. The body under pressure. 4. Treating the silent storm. And 5. The future of blood pressure. Let's get started. Section 1. The silent storm defined. So, what actually is hypertension? Let's look at this classic diagnostic threshold, 140 over 90 millimeters of mercury. For years, based on the JNC7 guidelines, this was the standard line in the sand for diagnosing hypertension. However, medical science is always evolving. Modern guidelines, like those from the American College of Cardiology, have actually shifted to a stricter threshold of 130 over 80. Why the shift? Well, because the research shows that catching and managing cardiovascular risks earlier can significantly reduce the chances of future complications. When we diagnose hypertension, we generally split it into two main categories. The vast majority of cases fall under what we call primary or essential hypertension. This just means there's no single obvious underlying medical cause. It's a complex mix of your genetics and your lifestyle. Secondary hypertension, on the other hand, accounts for about 5 to 10% of cases. This is where the high blood pressure is a direct symptom of an underlying condition. Think chronic kidney disease, endocrine disorders, or even using certain over-the-counter medications like ibuprofen or oral contraceptives. Section 2. Causes and hidden triggers. What exactly raises the pressure? When we examine the major risk factors for primary hypertension, we see a real mix of things we can't control and things we definitely can. Obviously, you can't change your family history or your genetics. However, environmental factors and lifestyle choices play a massive role. Excess sodium intake, obesity, a sedentary lifestyle, tobacco consumption, heavy alcohol intake, and chronic stress are all heavily implicated here. The big takeaway is actually incredibly empowering. While our genetics might load the gun, our daily lifestyle modifications are incredibly powerful tools to keep the safety on. Section 3. The body under pressure. Let's dive into the pathophysiology. Let's put on our lab coats for a second and use a plumbing metaphor to understand the renin-angiotensin-aldosterone system, or RAS for short. Imagine your kidneys are the water pressure sensors for your house. If they sense low flow, they release an enzyme called renin. This kicks off a whole chain reaction that produces angiotensin II, which aggressively constricts your blood vessels, literally like squeezing a garden hose to increase the pressure. Finally, aldosterone is released, which tells your kidneys to hold on to sodium and water, pumping up the total volume of fluid in the system. In hypertension, this emergency fluid retention system just gets chronically overworked and stays locked in the on position. But it's not just the kidneys running the show. The nervous system is deeply involved too. In the sympathetic nervous system, you have these pressure sensors called baroreceptors located in your neck, specifically in the carotid sinus. Normally, when blood pressure rises, these sensors are supposed to tell the brain to dial back the nervous system. But in hypertensive folks, the sympathetic nervous system is often overactive. This constant flood of stress hormones, or catecholamines, actually leads to long-term injury in the kidney tissues and makes the body hypersensitive to salt, which further drives up the pressure. Section 4. Treating the silent storm. let's look at some clinical interventions. And hey, if you're finding this breakdown of medical science helpful, please take a quick second to like this explainer and subscribe to the channel. It really helps support our mission of providing accessible, evidence-based medical education. When it comes to treatment, clinical targets have actually been a bit of a debate between two major schools of thought. The JNC8 guidelines generally targeted keeping blood pressure under 140/90 for most patients. However, the newer American College of Cardiology, or ACC guidelines, push for that stricter target of under 130/80. The ACC approach is highly focused on a patient's 10-year risk of atherosclerotic cardiovascular disease. Modern medicine is shifting toward these earlier, more aggressive interventions because the evidence clearly shows that even slight reductions in blood pressure significantly cut the risk of heart attacks and strokes down the road. Beyond lifestyle changes, we have a highly effective pharmacological arsenal at our disposal. The heavy hitters include ACE inhibitors and ARBs, which directly interrupt that RAS plumbing system we talked about earlier, stopping vessel constriction and protecting the kidneys. Then you have thiazide diuretics, which help the body flush out excess sodium and fluid volume. Calcium channel blockers directly relax the blood vessel walls, and beta blockers slow down the heart rate and reduce the force of contraction. A lot of the time, doctors will actually use these medications synergistically, combining them to attack high blood pressure from multiple angles all at once. Section 5. The future of blood pressure. What is the emerging research telling us? Now, I really want to emphasize that these next concepts are emerging scientific findings, not current clinical treatments, but they offer a completely fascinating glimpse into where medicine is heading. First up is the gut vascular axis. We're learning that our diet impacts blood pressure not just through sodium, but through our gut microbiome. Recent animal studies involving fecal microbiota transplantation have shown that the abundance of specific gut bacteria, like Tachycardia, directly correlates with changes in systolic blood pressure. This just shows how incredibly interconnected our bodies are. The research suggests these bacteria influence blood pressure by activating immune T cells in the gut, which then accumulate right in our blood vessels. Even more surprising is the potential role of our nose. Following the Nobel Prize-winning discoveries around the olfactory system, researchers started looking at how smell impacts blood pressure. Emerging research in rat models has found that activating specific calcium-sensing receptors through olfactory input, literally through smell, can actually affect the sympathetic nervous system's control of blood pressure. While translating sniffing volatile compounds into human therapies is still a long way off, establishing this link in animal models is a massive step forward. Now, looking at tissue-specific mRNA expression data, there's a really interesting finding regarding the kidney. The kidney is the absolute top site for the expression of a protein called klotho. Klotho is an anti-aging gene, and as the biological data clearly shows, it is expressed in incredibly high amounts in the human kidney. A defect in this specific gene actually leads to accelerated aging and severe arteriosclerosis. Because klotho is just so vital, researchers asked a pretty logical question. What if we add it back into a diseased system? In a study using diabetic mouse models, researchers supplemented the mice with exogenous klotho protein. The results were highly promising. Not only did it reduce harmful structural changes in the kidneys, but it successfully dropped their blood pressure from 113 down to 105 millimeters of mercury by calming down that overactive RAAS mechanism. This reveals massive future therapeutic potential for treating hypertension at a genetic and molecular level. We've covered a whole lot of ground today, from the basic definitions of the silent storm and its hidden triggers to the plumbing of the RAS system, and all the way to the frontiers of gut bacteria and the klotho protein. Remember our mission here as Dr. Evidentia. We want you equipped with the evidence to make informed health decisions. Since we know that lifestyle is a massive driver of this silent storm, I want to leave you with a provocative question. What lifestyle change will you make today to calm the storm? Drop your answers in the comments below. I would absolutely love to read them. Stay healthy, stay informed, and I'll see you in the next explainer.